Hi, this is Dr. Tenner here at the Goldberg Clinic for Chronic Disease Reversal. We're located in Atlanta, Georgia, and today I would like to present an interview with one of our patients. This particular patient came to see us from Phoenix, Arizona, and over half of the patients that we work with actually come to see us from out of state. This particular patient came to see us with a medical diagnosis of rheumatoid arthritis. And so the patient came for her initial visit. We did a comprehensive workup, which included a case history, a physical exam, as well as some laboratory studies. And we developed an individualized program for that patient to begin following. We followed up with her for the first 2 months over the phone and via email. And the following interview is a detailed account of the patient's experience with us during that time and the significant improvements that she has seen while under our care.
We're 2 months into our program, and Jessica came to our clinic with the diagnosis of
rheumatoid arthritis.
And you were originally diagnosed with that, Jessica, when?
About 10 years ago.
10 years ago. You were at what age at that point?
16.
When you were 16. And what had been the course of action that you had taken with your medical doctors in the so-called treatment of the rheumatoid arthritis?
I originally went to the doctor, a rheumatologist, who immediately wanted to get me on methotrexate, steroids, and I just kind of always had a bad vibe about it, so I decided to not take the drugs, and I kind of just let it go. And then about 3 years ago it started progressively getting worse, so I went back to the rheumatologist and decided to give the drugs a shot because I was in so much agony. And I attempted the drugs, they weren't really doing anything. The steroids helped, but I knew how bad they were for you, so I decided to just quit all the meds. And I suffered for a little bit, and then I found you and I came here.
Okay. And how long were you on? This was Enbrel, and you were on steroids?
Enbrel, yeah, prednisone and methotrexate.
And methotrexate. And how long a period were you on those for?
Not too long, probably 6 months to a year.
Okay. And during that time you were on them, what happened? How did you feel?
The prednisone, the steroid helped me feel all of the inflammation calm down. The methotrexate and the Enbrel did very, very little. So once I stopped taking the steroid, all the inflammation pretty much came back. So initially things were good, but in the long run things
And Jessica, you are by occupation a
registered nurse.
You're a registered nurse, and you work in what area of nursing?
Oncology.
You're an oncological nurse. And so fortunately, you were familiar with the side effects of these drugs, including steroids.
Yes.
Okay.
I see patients all the time coming in who have taken these drugs and they're just a mess. And I didn't want that to be me someday.
What kind of things do you normally see with people that are on steroids? We see patients constantly.
Terrible skin, just bloated, just organ failure, all kinds of terrible things from
Yes.
long-term use of steroids. And I just did not, I knew there was another way to do things.
Yeah, steroids are somewhat the bane of our existence in our practice because we know that steroids lead to the things you mentioned, in addition to diabetes, osteoporosis, and cataracts, and adrenal atrophy, and the list goes on and on. It's kind of enjoy now, but you're going to pay significant later on. All right, and we see a lot of patients with rheumatoid arthritis. We have other videos you can watch with them, and one of the things in common though is with the patients is that they generally receive the same set of drugs. Once they are labeled, there's a label they're given based on their symptoms with rheumatoid arthritis, then they are prescribed usually a set of drugs, methotrexate, prednisone, and then usually goes into the so-called biological drugs such as Enbrel and Remicade and Humira, all of which have a number of side effects, including immune suppression that can lead to serious infections and right along your line of which you work in, cancer as well. All right, you came to our clinic 3 months ago. We started you on a program 2 months ago. And at this point, 2 months into the program, tell us what progress you have made, please.
Well, initially, probably after a week, 2 weeks, I was experiencing quite a bit of muscle achiness, fibromyalgia type pain, and when I would wake up, I would just just feel terrible upon waking.
This is how you felt when you first came in.
Yeah,
Yeah.
before, and I mean, I just felt sick. I just felt overall just terrible. Like I wasn't enjoying no quality of life. I wasn't enjoying anything I was doing. I was basically sleeping all the time and then trying to get enough energy to go to work, and then at work I was in so much pain. I just was a terrible cycle. So even just after a couple of weeks, the muscle pain completely subsided. My fatigue pretty much went away within 3 weeks. I have so much more energy. I still have some joint pain, but the debilitating symptoms that I was having, the muscle pain, achiness, fatigue, those are all gone. So, I mean, I think I've improved substantially since I first came in after just 2 months of treatment.
And again, the condition you were first diagnosed with, was it 10 years ago?
Yes, 10 years ago.
10 years ago,
Mhm.
okay. All right. Every patient who gets labeled with rheumatoid arthritis is different. But it's our experience that when people have autoimmune issues that are labeled with rheumatoid arthritis, if the causes are identified and they're addressed thoroughly, that patients can make a recovery. And we're looking forward to Jessica. She's already about 65%, is that correct? About 65% improved. And we're looking to see over time, it's only been 2 months, we're looking to see ongoing and continued improvement, rather than this constant downhill cycle that she was on, and also one where she was taking dangerous drugs. Well, she'll now be able to enjoy life, enjoy greater freedom of movement, engage even more fully in her occupation as a nurse, and look forward to being in control of her own health. So once again, the real health care, as we talked about the Goldberg Clinic, becomes self-care. Jessica, thank you very much.
Thank you very much.